From the training, there are some changes that we had. For example, on the number of contacts. Before we had only 4 contacts, but from the training they emphasized of 8 contacts. From there I came back, health educated my communities to the extent that I went to churches, community gatherings, at least emphasizing about the 8 visits, the 8 contacts. It has benefited the health center by getting new updates. For example, by then we used to treat malaria using quinine as a first-line drug, but right now we are using Coartem regardless to any trimester. That is in first line. That is as a first-line drug of treatment. We've seen that quinine was causing some miscarriages, and at least Coartem is not causing any miscarriage, and mothers are okay.
In addition to orienting them on the new policy of 8 antenatal visits, we also emphasized providing prophylaxis with Fansida, prophylaxis for malaria with Fansida for the 8 times as well. SURMa has also supported us to conduct external quality assurance and microscopy training, where laboratory personnel were trained, 13 in number, and what they do is they're given blind microscope slides where experts already know the results. Our health workers are given blind slides. It is them to look at the slides under the microscope and tell these people whether it is positive or negative, in a bid to ensure quality of our testing, because it's the mainstay now of malaria management as a policy of the Ministry of Health.
Again, also with the training that has been conducted, we have the test treat strategy, and it's being applied everywhere. Okay, at the facility, before treating, you make sure you test the person positive. If the person is positive, then you treat. The person is negative, investigate for other things, and you treat. So basically, that is the support which we got, and it is being practiced. Previously, there were interventions that were in place, but people, people tends to get relaxed at the end of it. But now with SURMa activity coming on board, there is close monitoring, okay, of data, of the quality of work, and that has made even more, has put in place more quality in terms of care to the client. Okay, there was some laxity that people could get treated without test. But now there is testing first, then you treat, and that has reduced some cost on the regimens that are available, and maybe even the issue of out of stock, it has reduced on it, and now you treat the cases that are exactly malaria. Okay, and appropriately looking at the severity, because of the capacity of the staffs that are built. Yeah, you look at which patient is qualifying to have this medicine. The staffs, the technical staffs also, their capacity has been built in performing RDT test. So these other staffs, when the lab person is not around, they perform the test.